Hi, so today I'm going to be walking us through a medical assessment of a 42-year-old patient who collapsed at her daughter's soccer game. So the first thing you're going to want to do is the scene size up. So assess the safety of the scene, determine how many patients there are. There's one, determine mechanism of injury. She collapsed. Call 911, get the AED, and then see if there's C-spine. There's no need, and then general impression is more bad than good, just because we don't know. See, as you can see right there, I was alerting her to check for her level of consciousness. And now, and she is conscious. And now what I'm doing is I'm telling her my name, who I am, my certification, and asking her if it's all right if I help her. And she obviously says yes. And so the chief complaint is she collapsed and she needs some help. So the first thing that I'm going to be doing is assessing the airway and the breathing. So what I'm going to be doing is I'm taking her radial pulse, and then I am watching her breathing patterns, the frequency of her breath while timing it, taking her pulse ox. And then there was no need for any major bleeding control. She wasn't bleeding anywhere. And general impression of her skin color, temperature, it was normal. So now, moving on to the secondary assessment, I am starting with the baseline vitals. So that's where the pulse ox comes in, blood pressure. So go. I hope this doesn't lag when you're watching it. It's lagging for me, so I hope not. Okay, and then BP was normal. So now the next step would be the OPQRST, but in this situation, it was not necessary. And so what we're gonna do now is let's go through sample. So S in sample is, oh, sorry, my bad. I got a little excited. Right here, I'm demonstrating I'm doing the sticky test, the sticky check to see if there was any bleeding, but there wasn't. And then we're moving on to sample. So sample, S stands for symptoms, signs and symptoms. So I asked her how she was feeling. She told me that she was feeling dizzy and a little bit woozy. Then I asked her if she had any allergies, which is A, and she said she didn't have any. Then I asked her for M, which is medications that she's taking, and she says that she takes the daily menstrual regulation medication, which is very common and normal. And then I asked if she knows of any history of this in her family or for herself, and she said there wasn't any known history of collapsing. Then L, I asked for her last input and output and outtake. So the last thing she ate was breakfast cereal around 8 a.m. and she went to the bathroom about an hour before. And the events leading up to the event was she was just watching her daughter's game, and the next thing she knew, she was on the ground. And so that is the sample. And then if needed, I could do DCAT BTLS, but it wasn't necessary in this situation. So I just monitored her vitals and the ongoing assessment with the ABCs and everything. And she was okay. Am I still recording? Am I? I don't know. I hope that worked. I am still recording.